The main aims of the project here at Salford Royal was to deliver single-sex accommodation on our emergency assessment unit, emergency clinical decisions unit and the heart care unit by September 2009. The key challenges in the emergency areas were that we have a high patient turnover. We don't know from hour to hour whether the patients that are going to be admitted are going to be male or female. We sent out a number of questionnaires to patients upon their admission, asking them were they directly admitted to single-sex accommodation, how did they feel about that. The nurses were quite surprised at the result, and they were disappointed to find that we weren't providing the highest possible standard of care that we could provide.
We were asking questions, for example, have you passed water? Have you been to the toilet today? In a mixed-sex environment where people were embarrassed to give an answer and may not give the correct answer, it made us realise that it was a problem.
We applied for some funding from the Privacy and Dignity Fund to help with the relocation and redesign of 2 of our areas. The emergency clinical decisions unit needed to be completely redesigned. We had a day area that was quite inappropriate really, so we used that to build a new bathroom. In the emergency admissions unit, the staff had tried to deliver same-sex accommodation in the past and had failed, so it was very much the idea that we've tried it, it didn't work, why do we have to do this? It's not going to work again. We decided to take a collaborative approach whereby we gathered various members of the healthcare team, medics, nurses, bed managers, and got them all in a room and heard their opinions and shared views about how we would take this project forward.
I thought it'd be quite difficult at first, that we'd struggle maintaining it just because of the flow from A&E to here, but now we're getting there.
It's a culture change and it does take time for people to become used to the idea that things can work differently.
The idea Alison came up with was to start in small steps, start with 1 bed in 1 bay and make that male.
We then tested it on 1 day for 1 patient or with 1 nurse, and then evaluated that, spread it again, tested it again, and eventually it spread throughout the pilot areas.
How's it been over the weekend? Not too bad actually.
Now, what we tend to do is if there's 1 bay that is catching all the admissions, then the team that isn't can go and help.
If there is a problem, staff are encouraged to get in touch with me. If I'm on duty, there is always a medical matron around who can come down, liaise with A&E, liaise with the ward, identify problems in moving the patient and potentially stop the breach.
The most significant result was from our EAU, where we had a baseline of 19% compliance. That figure then turned in about 4 to 6 weeks to over 96% compliance just by the cultural practice being changed.
What's made the project a success is involving the whole team at the start, having a common goal.
Feeling amongst the nursing staff now is this, that we should be delivering single-sex accommodation to all of our patients, and it is something that we can achieve.